Hello and welcome to the Nurseversity. My name is Holly and today I'm going to be reviewing hyperkalemia. This presentation is all about the information that nursing students need to know to pass their fluid and electrolyte exam, as well as be successful in the clinical setting. So the first thing that we want to do is define the word hyperkalemia. Now you may already know what it means, but it never hurts to stay fresh on our root words and our prefixes. So you can see here I have the word defined. We have hyper, that means high. Kal, the K-A-L, is referring to potassium. It's the prefix for potassium. And emia means in the blood. So if you put it all together, hyperkalemia means high potassium in the blood. The normal range for potassium in the blood is 3.5 to 5 MEQs per liter. So hyperkalemia is defined as a lab value greater than 5 MEQs per liter. Since potassium is the electrolyte in question, let's now review the regulation of potassium in the body as well as the role that potassium plays. Potassium is mainly regulated by the kidneys. The adrenal glands, which sit right on top of the kidneys, secrete aldosterone, which regulates the levels of potassium in the following way. When potassium is high, aldosterone causes more potassium to be excreted in the urine, and when potassium is low, aldosterone secretion is decreased, therefore less potassium is signaled to be excreted from the urine. So you see here we have, just imagine a little adrenal gland right on top of the kidney here. It secretes aldosterone, which then causes potassium to be excreted in the urine. From this information you may be able to conclude that the excretion of potassium mainly occurs through urination. It's about 80 to 90%, and the rest of the 10 to 20% is excreted in the sweat and in the stool. So now let's review what is exactly the role of potassium in the body. Well, the potassium has several different roles, and some of them include maintaining fluid volume, pH balance, and protein synthesis. But the main function that you should focus on about potassium is the role that it plays in excitable cells. These cells include neurons and muscle fibers, and those muscle fibers are smooth, cardiac, and skeletal. Potassium is an essential element in action potentials or impulses in these excitable cells. Therefore, potassium plays a key role in nerve conduction and muscle contractility. The simplest way to think about this concept is that hyperkalemia will cause increased excitability in excitable cells. So what are the causes of hyperkalemia? Well, all of these different causes are going to be causing the blood levels of potassium to be increasing. The first cause that we see is with potassium-sparing diuretics. These diuretics cause the body to hold onto potassium instead of excreting it, as we see in potassium-depleting diuretics. So patients who are on these medications are at high risk of developing hyperkalemia. And we have two common potassium-sparing diuretics here, spironolactone and triamterene. The next cause that we have is the hypoaldosteronism or Addison's disease, which is also known as adrenal insufficiency. So we talked about how the adrenal glands secrete aldosterone. If our adrenals are insufficient, then they aren't secreting an adequate amount of aldosterone. And if we don't have enough aldosterone, then our body is unable to signal the action of excreting excess potassium, hence the development of hyperkalemia. So decreased aldosterone is going to decrease the amount of potassium that is excreted in our urine, leaving that potassium in our blood. Next up, we have kidney disease. If our kidneys are not working, then we're not going to be able to excrete the potassium in the urine as we normally would. Damaged kidneys are not able to filter at an optimal level. Therefore, people who have kidney disease are at high risk of developing hyperkalemia. And if these individuals continue to eat foods that are high in potassium, that risk will increase even more. A next cause that we have are tissue damage or burns. The cells in the tissues that are damaged during the tissue damage or the burns will die. During this cell death, potassium is released and enters the bloodstream, therefore increasing blood levels of potassium. So right here we have this little circle, which is supposed to be the cell, and I just drew these little X's on it to signify that the cell is dying. When the cell dies, the contents of the cell is released into the bloodstream, and since we have potassium that's inside our cells, we're going to have a large amount of potassium that is then shifted into the bloodstream as those cells die, which then causes hyperkalemia. The last cause that we're going to review here is acidosis. So potassium, which is normally in the cells, is then moved into the extracellular space in exchange for hydrogen ions, therefore increasing the level of potassium. If you watch the video on hypokalemia, then you will know we had the opposite of this. We had alkalosis. In hyperkalemia, we have acidosis that causes the issue we have, and this time potassium is being shifted out of the cell as hydrogen ions are shifted into the cell. So let's review the signs and symptoms. When you're thinking about signs and symptoms, I want you to think about increased muscle activity and increased neuronal activity due to the abundance of potassium. So we're going to have increased excitability. So in the early stages of hyperkalemia, a patient will likely experience muscle twitching. However, as the hyperkalemia is sustained or worsened, weakness actually can occur and flaccid paralysis may even result. We're going to have increased intestinal peristalsis in individuals who have hyperkalemia. The smooth muscle of our bowel is an excitable tissue, and so it will experience negative effects from an imbalance in potassium. And if we think increased excitability, we can think increased intestinal peristalsis. So these patients are likely to experience diarrhea. We also have dysrhythmias that can occur. The cardiac muscle is affected by an increase in potassium in the blood. Severe hyperkalemia can even lead to cardiac arrest, as we can see here. There are some different ECG changes that can occur. They're listed here. We have tall peaked T waves, a widened QRS complex, and a prolonged PR interval. The cardiac manifestations that can occur with hyperkalemia, as you can see with the cardiac arrest, can be fatal. So with hyperkalemia, the cardiac manifestations will likely be your priority. We then have paresthesia that can occur. This is just an abnormal sensation of tingling or numbness. It could be described as kind of like pins and needles, like whenever your foot falls asleep and you kind of have that tingly sensation. They can have this in their fingers or around their mouth. So how are we going to treat someone who has hyperkalemia? Well, we have a couple different options. Well, we have several different options. The first one is K-Exolate. Now, this medication actually excretes potassium in the stool. So we're going to take all that extra potassium that's in the blood and shift it into the stool, and then they will pass it in the form of poo-poo. That was not very medical sounding, but you get the idea. Then we have the option of using IV insulin plus glucose. So insulin doesn't only shift glucose into the cells, it actually shifts potassium as well. So we can use that to take the potassium that's in the bloodstream and move it into the cell. But we also have to give glucose so that we don't cause hypoglycemia in the midst of all of that. We also have a potassium depleting diuretic that we could use. This is only going to be appropriate if the patient's kidneys are working. Diuretics cause potassium to be excreted in the urine. So we're going to take all that potassium that's in the blood, and not all of it obviously, but some of the potassium that's in the blood, and excrete it in the urine. We can also use dialysis. Dialysis is sometimes referred to as an external kidney. So if our kidneys are not working, we can use dialysis as a form of filtering the blood to get all that extra potassium out. And the final treatment here is calcium gluconate. Because hyperkalemia can be damaging to the cardiac tissue and severe cardiac manifestations may occur, calcium gluconate is used to negate these effects. It is important to note that calcium gluconate will not lower the potassium levels in the blood. It's just used to prevent fatal cardiac arrhythmias and the manifestations that are occurring that way. So this is not going to do anything to your potassium level, so you would want to use this in conjunction with the treatment that's going to actually reduce the potassium levels. So now let's just review a couple nursing considerations that you're going to want to keep in mind. As I mentioned, the cardiac manifestations that can occur with hyperkalemia can be fatal, so we're going to want to monitor that very closely. So we're going to want to have them on telemetry and be monitoring that very, very closely. If you have to give calcium gluconate IV, make sure you push it very slowly. This is not one that you just go slam in. It should be administered slowly. And finally, we're going to want to educate our patients who have hyperkalemia to avoid foods that are high in potassium. So you can see here we have bananas, avocados, spinach, beans, and sweet potatoes. And that's it. We covered the causes, the signs and symptoms, the treatments, and the nursing considerations. I hope that this was helpful to you. If you find this content to be useful, please consider giving a subscribe so that you can have easy access to all the information that I post. In the description, I'm going to link the study guide and cheat sheet that I have available over on my website that includes all the highlighted information from this presentation. Thank you for watching and happy nursing!